Welcome to the Cup of Nurses podcast.
Hey guys, welcome to Cup of Nurses podcast. We're your hosts once again, Matt Stratrick, and myself, Peter from Dura. This is episode number 12, I believe, or 11. Episode number 11.
11.
Today we're going to talk about microplastics in an environment and some issues that men face today. So some mental health issues and microplastics.
Yeah, so whoever watches the podcast and listens, thank you guys. Keep subscribing, keep listening, keep sharing it with your friends if you can. We kind of really want to grow organically, so we appreciate all the comments and subscribers and everything else that you guys do for us. Thank you. So today's topic, we talked about microplastics. So when we think about plastics, we think that we consume it on the outside, but we don't realize how plastics might be ingested inside of us. So there's a study from the Environmental Science and Technology that shows that Americans are eating, drinking, and breathing in an estimated of 24,000 to 121,000 microplastics each year. And it all depends on age and gender, but most of them is from plastic bottles, and whatever we're storing food in, the plastic is shedding into our food.
Yeah, when you bring up microplastics, the first thing that comes to my mind is like the ocean and fish and seals digesting plastics, they're getting stuck in them. But what we fail to realize is that the microplastics also affect us from decomposition when it goes into the air, or just through the, like Matt said, through water bottles, through tap water, things that we drink. There's plastic in the air from decomposition, and then we also ingest plastic because we put things in plastic.
And it gets decomposed into the ocean as well, what people are doing to recycle. And the fish are, consuming this. There's a scientific study that shows that 114 marine life species that we consume, more than half of them end up on our dinner plate, which contain microplastics. And another crazy caveat is if you consume water bottles versus tap water, you're consuming an additional 90,000 microplastics a year.
Yeah, something we really disregard. Plastics are something new. Like I remember, or not actually, I don't remember, but we used to put Coca-Cola in glass bottles. We used to put drinks in glass bottles. Everything used to be glass. And then we found this great new material, plastic. I'm not even sure what's it made out of. It's just called plastic.
It's cheap and it's reusable.
Yeah, cheap and reusable, but we don't really reuse it too much. We do now. Back in the day, it was kind of just thrown out and it kind of sat there. But now you can melt it down and make whatever you want of it. But a lot of it gets thrown in the ocean. And like Matt said, fish eat this, animals eat this, and we end up eating these animals, and we get the plastic that they ingest also goes into our bodies.
Yeah, and the question you guys might have for us is, what happens to our body when we consume this, and what are the side effects? Unfortunately, as of now, there is no correlation between humans and microplastics, so there's no evidence that shows that this is harmful, but we know for sure that it could cause issues in, for example, marine life. So they studied the effects of microplastics in fish, and it showed a few different things like endocrine disruption, immunocompromised stress response from the immune system, obstruction from the gills and creating lesions like in the bowel, cardiotoxicity, muscle toxicity, and even liver toxicity. So if this is happening into fish, and for the most part we're very complex, but if there's some kind of effect, then it's going to affect us for sure. We just don't know it yet, just like Bluetooth and everything else with these emerging technologies.
Yeah, it's very interesting because this is something new that's going on with these animals. And hopefully we don't get to the point where we develop these illnesses that these animals do, because a lot of people are now pushing more for more environmental friendly things and more for the ecosystem. So maybe we will never find out what microplastics was, which will be ideal. But maybe there is something small going on now. Hopefully it doesn't ruin something big, but you just never know.
Well, they're saying that if you consume plastic products, they have BPH, so now all these plastics have like BPH-free labels. And what was it? Well, we knew that when it was getting released and we consumed it, it messed with our estrogen, and it affected testosterone, which is something we'll talk about. So there's definitely something going on. And when I was looking this up into the marine, there was a National Geographic research, and it showed these little see-through shrimp that these microplastics were hanging out in their gut, and they couldn't get rid of them. So there's something up.
Yeah, I mean, they can't get rid of them. It's actually interesting that they're so small, so they're easier to study. So you could see how things travel through their whole system.
They're see-through, cool. And they kind of shine the light, and they kind of showed these plastics just hanging around.
Yeah, and it's pretty interesting how you said that it affects estrogen. So a lot of people with these sexual issues, that do some harm.
It can. What's the topic that we're going to talk about after our current health trend here?
Well, it's June, so it's Men's History Month, and I believe we're approaching Men's Health Month, and I believe we're approaching Men's Health Week, which is another week in June that's also focused on men's health. But in 2019, the things that plagued men the most with issues is testosterone, prostate and skin issues, heart disease, liver disease, suicides, and diabetes. And I think a lot of times we hear Breast Cancer Awareness Month. We see a lot of things we see a lot of women's issues getting put like mainstream, that are getting a lot of focus, and I feel like men's issues aren't as like prevalent.
We're being kind of tucked away. Society's not seeing us, the things that we're struggling with. So here we're developing a whole episode, and there's a week and a month for men, just to kind of bring awareness that, hey, we like to think we're very strong and very resilient, but just like women, we're very prevalent to diseases as well.
Yeah, I don't think it's not necessarily society's fault that men are plagued with these issues. It's more of like we feel like we're the backbone of society in most times, and we see ourselves as like untouchable almost. We don't want to admit to our vulnerabilities. We don't want to say, hey, I'm sick, hey, we're sick, because that gives like a feeling that we can't provide. And I think that's one of the main reasons why these things aren't addressed as often, because we're not willing to come forward with these issues when we have them.
That's what it is. Men do not go to the doctors. They do not get checked up. They don't do anything prevention of. Usually they end up when they have some very killer abdominal pain or some crazy chest pain that they can't handle, and they have to go to the ER. And that's when that happens. There's never like a little prevention of, oh, let me do a stress test, or let me kind of check my lab results and see how my diet is. None of that is even acknowledged. It's all about just work, and we're these strong, freaking resilient people because we created society in a way, and everything that happened, the wars that we fought, and we have like this reputation that we have to be strong and invulnerable and all that.
Yeah. And unfortunately, when shit hits the fan, it's hard, and a lot of times you can't recover, or it's too late, and then you look back on, hey, if I wasn't just so egotistic, or if I would have like corrected this issue in the first place, this wouldn't have happened. You see a lot of times back pain. Men just deal with back pain all the time, and then they deal with it for years and years and years, and next thing they know is they have like a herniated disc, or they have something happen where it's unrepairable now, or they need spinal surgery, compared to if they would have came 5 years ago, where they could have just got some alignments, some stretches, and they would have been fine.
That would be interesting to see like the prevalence of male injuries in the gym, and see what are the issues. If there was like a herniated disc, was it like a tendon that was kind of stretched? Because I feel like there's a lot of ego in the gym too, and like people don't use belts properly and safety machines. We're just kind of like, let's lift the most weight, so let's be like the biggest gorilla here and kind of pounding our chest and stuff like that. But that's not what it's about.
Yeah. Well, speaking of being a big gorilla, touch on testosterone.
Yeah.
So testosterone, we looked up, and it was like the number one issue for men. That's because our testosterone peaks throughout our life, and it starts to decrease in our 30s. And unfortunately, with that decrease, that's our male sex hormone. We're going to see the most drastic changes with that being decreased. Just like women, when they go through menopause, they have a drastic decline in estrogen, I'm pretty sure. Right? Or I'm pretty sure they decrease estrogen, so like That's kind of, you could kind of view it as like male menopause.
And it's also the sex hormone. So when we say that there's like a little fad that says men think about sex more often than women. Well, essentially it can be true in some aspect, because we have a higher amounts of testosterone, and it's in charge of our like sexual characteristics.
Yeah. And there is certain illnesses and certain genetic issues that naturally you will have low testosterone, and a lot of times with that they'll put you on testosterone like therapy, replacement therapy.
Yeah.
You need that at that point in time, because you need that to grow. You need to develop muscles, to develop mentally, physically. You need testosterone. Yeah. But some of us are plagued with like borderline testosterone, which might affect like you a little bit here and there.
Yeah. Part. And testosterone is even in charge of red blood cell production. So it's kind of crazy. And usually we think that testosterone declines after 30. We're starting to see it more prevalent. We're not seeing high amounts of testosterone because of the way we're exposed to all the environmental characteristics, or not characteristics, but stimuli that's affecting our testosterone. So, and I personally wanted to get my testosterone checked too once. I went to the doctor. I'm like, hey, can I get my testosterone checked? Because I was asking for like the electrolytes and cholesterol and all that. First thing she asked me, she's like, do you have your like erectile dysfunction, or do you have a hard time getting it up? And I was like thinking, like, should I lie about it? It's like, no, I'm not gonna lie about it. I'm like, I'm fine. She's like, well, then there's no need to take the test. I'm like, damn it, I really want to get my T-test.
They're just curious sometimes, and like usually, I don't know why, but a lot of times they won't test for it unless they see some kind of issue. Which, I mean, it's like kind of just like, it's my body. Why can't you just run the test? I'm gonna pay for it anyways.
The insurance will pay for it.
Yeah. And you're gonna pay the insurance company. But testosterone, if you have low testosterone, you're naturally gonna have a lower sex drive. If you're borderline, that might happen as well. But the thing is, upon curious, is like you start to get lower testosterone and lower sex drive after your 30s. But then I remember seeing online where it's like the highest prevalence of like HIV and STDs are in like with old people in nursing homes. So if they're in their 60s and 70s and they're pumping it out, like it's kind of weird, right? If you think about it.
It is weird.
Like you're supposed to lose your sex drive when you get older, but these guys are hammering out in nursing homes, which is pretty interesting.
Is that what you've seen? Is that what you heard?
I mean, it's not what I've seen, but that's what I read online because I'm into that kind of stuff, So.
Right. Another thing that is a sign and symptom of low testosterone is alopecia. Am I pronouncing that right? That's basically baldness. So if you're starting to lose hair, if you're starting to realize that something is not part of the aging process where you're very young, you should maybe get your testosterone checked because it might be, causing issues.
Yeah, it could be attributed to testosterone, but there is like early onset baldness too that unfortunately some people deal with. Yeah, and sometimes when I look at my hair, sometimes I feel like I'm balding, but I don't think I am. Hopefully not. But there is early onset baldness. It might not be exact. So if you're balding or you're bald doesn't mean you have low testosterone. It just might be.
It can be a sign or symptom, not directly correlated. So there's other things you have to consider.
Yeah. Low testosterone is also attributed to like low mood, like less excitement doing things that you normally were excited with in the past, and also more fatigue and like memory issues. Which I mean, I'm not sure.
It's like that masculine energy. It's like as a man, you should be having like this vital force energy. And we're like the creators and the movers, and that energy should be, representative of you. So if you're like one of these people that are like just withdrawn and rather just sit at home and not do anything, then that could be, it could be maybe whatever, depression or accident, all that, but it could be testosterone that's linking this. So
yeah, like if you have a hard time finding pleasure in doing things, you might have low testosterone. You might not want to hop on the SSRIs right away. You might want to just get your T's checked, Maybe that's just low. Maybe you just need to just boost up a little bit. Maybe you don't really need to hop on like testosterone replacement therapy. Maybe you could just do certain activities that might boost testosterone. Maybe change some stuff around.
Yeah.
But I think that's with the fatigue, like you said, it could be attributed to like the low red blood cells that also attribute to low testosterone. So that makes sense.
Yeah.
You have less like nutritious, oxygen-rich blood.
Yeah, and that's why athletes kind of take steroids because they're anabolic. They produce more red blood cells, and if you think about it, you have more red blood cells to carry oxygen and all that, and that's boosting you up. And a lot of these, I don't know who dopes, but usually like the cyclists that we've heard of.
Armstrong.
Arnold. Is that his name?
I think so. Yeah, it is. People also go work out in like the mountains too, right? So that makes your oxygen, well, that's kind of different from this, but I know when they go work out in the mountains and the altitude's higher.
I think if you're born in higher altitudes, you have more red blood cells because you have a higher oxygen demand naturally. So that's something that's very environmental based.
Yeah, that's why people work out like out in the mountain before they fight. They work out higher up in elevation because when they come down to elevation, it's a little bit easier for them because you got more oxygen available to you.
Didn't you hear about that for like soccer players before they play like some really big game? They need to go there like 2 days prior or a couple days before to train, probably just to adjust to everything,
Yeah, I heard it was soccer players, and I think some of the swimmers might have done it, or some Olympians did it. I know that for sure. And I mean, if they're doing it, it's probably has some kind of fact to it,
Yeah. Another thing for tips for men: if you're really into the gym, you're working out, you're like struggling to get muscle mass, you're eating, you're sleeping enough, all these factors that are tying into proper growth, and you're still not growing adequately, then maybe you might have like a testosterone imbalance that's causing you to have increased fat mass and decreased muscle mass. Something to look into.
Yeah, I mean, it's something to look into too as well. And working out itself improves testosterone levels, but you might just be, below the baseline. And even though the gym's bringing you up to a little bit higher elevation of testosterone, you still might be short.
Yeah.
And you still might be getting the gains that you think so. But gains over time, it's a little bit each time. Don't expect, to build like 2 pounds of muscle within like the first week or first weeks of working out or the first month. It's a gradual increase. Don't fall in the thinking that, hey, I'm not.
It's like bro science.
Yeah, don't be bro science about it. That it's like, hey, my testosterone must be low because I'm not getting as much gains as I did last month, or I gained more. When I first started out, that I'm getting now. I'm plateauing. It's probably not just testosterone. You probably just switch up the workout a little bit.
Yeah, it's muscle memory. Eventually, whatever you're working out, your body gets used to it and it develops a routine, and you just need more stimuli to make that muscle grow. It's just like 5x5. I found it very, very good for me. I've grown, I gained a lot of strength, my deadlifts went up, my squats went up, but eventually months into the workout, I just crashed. I plateaued, I dropped the weights, whatever, I took the week off, went back into it, and I'm just plateauing. And my nervous system probably is just so used to this, and you just need a different type of workout. So now I'm doing a higher rep range and all that, so.
Yeah, guys, if you find yourself in a lower testosterone level or borderline where you don't really need placement therapy, we got a few ideas that you guys could do, like Matt said. Exercise regularly, get a well-balanced diet. You got to get nutrition from somewhere, and what you eat is what gets put in your body, and you make energy out of that, and it gets stored. You get your vitamins, you get your minerals, you get your healthy fats, which are important for hormone production. You want to minimize stress, minimize cortisol, because that has
back into the diet though. You are what you eat. Mm-hmm. So if you're not getting a well-balanced diet, how are you supposed to absorb everything? And we know that you have to eat specific amounts of protein and fat in order to absorb specific things. I don't know what the correlations are, but let's just say if you don't have any vitamin D, then you can't absorb iron, for example. Or if you're consuming too much caffeine, it halts iron absorption. So there's this fine balance that you have to fine tune your diet. And it's not about whatever the Google says, just listen to your body. Eat something, if it upsets your stomach, I think you should minimize that. I'm starting to realize that relationship with meat and cheese. I think too much dairy in my body is causing harm, gas, bloatingness, and I think I have to cut back, and I'm gonna in the next few weeks, and I'm gonna see how I feel. So diet is really, there's no fine-tuning diet that everybody should be eating, vegan. No, it's not for everybody, unfortunately. It's a fad. You have to listen to your body and see what you like and how do you feel day to day, your mood, based on what you're consuming.
Yeah, I completely agree. Warren Buffett drinks Coke and eats McDonald's, and
he's a happy man.
Yeah, he doesn't look the healthiest individual, but it's him through the day. I'm not saying do that, but I'm saying he has a lot of money, so if something goes bad, you can definitely afford to get the open heart surgery or something like that. He's got a medical team probably on call if he needs them. But so you got to gear your diet towards you. You obviously want to eat a little more if you're working out harder, otherwise you're just going to be tired all day. And being tired all day isn't good because that's going to affect your sleep, which minimizes testosterone, which decreases testosterone as well. If you're constantly chasing sleep and you're never well rested after a night's sleep, you probably need to change your sleep schedule, or something's going on because that's going to affect testosterone as well.
Yeah, there was a University of Chicago study that took I think 20 plus men, and for a whole week straight they slept 5 hours per night, and it showed a link of decrease of testosterone up to 15%. So when it comes to well-being, the first thing we like to tackle right away is our diet and our exercise. I think prioritize for your own self-love and self-care should be sleep. You should be getting that minimum amount of 7 or whatever the case might be. I think 6+ is ideal for me, so to function.
Yep.
And on top of sleep, if you're not sleeping enough, your cortisol levels are high because you're stressed out, and cortisol and testosterone are like a seesaw. If cortisol is up, testosterone is kind of going down. Just like insulin and is it human growth factor, the IGF, whatever. Yeah. It's like a seesaw. A lot of these hormones, they're like that. So you got to minimize stress and get some sleep. Testosterone, freaking tip number 1 here. To be honest.
Yeah, be healthy. Sleep healthy. Another issue that plagues a lot of men is prostate issues. We hear a lot about BPH, benign prostatic hyperplasia, which basically affects It doesn't affect everybody. It's 1 in 12 men get affected between the age of 31 and 40, and then it increases over as throughout age. But basically, your prostate grows and it kind of pushes pressure on your urethra and it obstructs your urine flow, so you have trouble urinating.
You know those old men in the hospital that like drip,
Yeah.
drip, drip, and they never empty their bladder full. Geez, I hope I'll never become that person.
Yeah, that'd be rough because they can't fully empty the bladder, or they dribble each time, and they can't get it fully out, or it just stops, and it's just, it sucks,
Yeah.
We're not exactly sure how this happens. It just happens to some men more than others. It might be a diet issue, it might be a hormonal issue, we're just not 100% sure. But this isn't cancerous. You could get like Flomax, or is that what it's called, Flomax?
Flomax, it's a pill.
It's a medication that helps with BPH, but it's not cancerous. It just enlarged prostate. So you could get it removed. Can you get it removed? I'm pretty sure you can get removed prostate.
You can, but there's so many issues,
Yeah.
and prostate is linked to sex drive, and your libido goes down and things. My grandpa actually had prostate CA, and what they did is they implanted these radiation seeds. So he had a little bit of radiation that was getting, put, and within like 6 months, the cancer completely went into remission, completely disappeared. But he, we call it, there's a day like test how's your urine stream, so that's better. But he has to wake up like 2 to 3 times a night sometimes to use the washroom.
Yeah,
It kind of sucks.
it's rough. That's right. I know with prostate cancer, 1 in 6 men get it, but the good thing about it is cancer doesn't matter what kind of cancer you get, it's gonna suck. But I guess the good thing about this cancer is it's usually slow growing. A lot of times it's caught, and out of those 1 out of 6 men, only 1 in 35 will actually die. Which it's still unfortunate, but it is a slow progressing cancer that can be caught early on.
So if you're a guy and you feel like you can't fully empty your bladder, you feel pressure, you're waking up at night to pee, maybe you should go ask your doctor to go get your prostate level checked and see what the level is. Sometimes it could be inflamed, and you have to switch a few things. I think a pumpkin seed supplement kind of helps with that. Not too sure, so don't quote me there.
Yeah. Another issue is that I found surprising is melanoma. We have a higher rate of melanoma, and we have a higher rate of death associated with melanoma. I guess our skin is a little bit harder and it has it's made out of different things, and it's just kind of different membrane in general compared to females. So I guess we're more prone to getting melanoma and actually dying from it compared to females. Even though females tan more than men, we're still somehow more prone to dying from melanoma than women, which I found really interesting because you hear a lot about skin cancer and you shouldn't tan, you shouldn't do this, but no one really touches upon like melanoma skin cancer.
And I don't know what kind of tips we could give for that one, but definitely put on some sunscreen and don't stay out in the sun too long. Have like a good exposure. If you're very high risk, if it runs in the family, avoid those times of the day when it's like the sun is peaking the high, which is like from 11 a.m. to like 2 or 3 p.m. So
yeah, another big one we're gonna address here is heart disease. I'm sure you've all heard about it, you've all seen it. But what I found a really crazy stat is that 80% of sudden cardiac events, like MIs, occur in men. And I believe you kind of tested, like most people you see come in after COVID are usually males, right?
Yeah, the heart attacks.
Yeah, unfortunately, like I said, a lot of times we just avoid the symptoms, avoid the chest pain with exertion, we just do a little bit less. We just avoid these little issues or these little signs of saying that, hey, my heart's not as good as it used to be. And then, bang, you get an MI and you get a heart attack and you're not the same.
You're never the same. Like your quality of life, like let's just say if your heart attack affects like you get ischemic on a certain part, especially the big vessels like the LAD, there's this percentage of your heart that's dead and you can't do things like you used to. You can't run, you can't exert yourself as much. So we have to be very cautious of things that can happen, and we have to learn how to prevent them. One of those risk factors is smoking. Stop smoking, lose some weight, fix up your diet. These are like so simple things that we talk about, yet it's so overlooked, and people do not do that because they just love to fall into their old habit of the same old things.
Yeah, it's unfortunate, and also like alcohol causes it. Diabetes plays a role. Coronary artery disease, I believe a quarter of men die from coronary artery disease due to probably an MI or something.
Yeah.
That's something that could potentially be, maybe it can't be fully avoided, but maybe you could prolong getting an MI. Instead of getting an MI at like 40, you get one at 70, which I prefer to live an extra 30 years,
That'd be nice. And let's just say you feel chest pain once in a while, or your jaw's a little numb, or you have a little bit of like numbness in your left shoulder that could kind of cause any of this, or it kind of went away but you felt it. it doesn't hurt to go to the doctor. You get some troponins maybe checked. I don't know if they would do that, but you could definitely get an EKG done. Basically that's some leads put onto you. They would do a test, which would be like a scan of like your heart, the electrical system, and they would see if there's any elevated ST depression or whatever the case might be, just to kind of dumb it down for people. And they would possibly tell you that, hey, part of your artery is slightly occluded and it's not giving enough oxygen to one side of the heart, and they might do things like stent it or get it ballooned angioplasty to give oxygen back into that side of the heart. And that's very important. And that's basically what a heart attack is. It's just lack of oxygen to a specific artery, specific side of the heart. So
yeah, and those coronaries, those are the ones that feed blood into your actual heart. We all think the heart pumps blood out to our organs, but also pumps blood to itself.
Yeah,
it's got to function with it.
It's supplying.
Yeah, actually, if you go on our show notes, we list what an electrocardiogram is, what an echo is, what a stress test is, and an angiogram if you want more information about that.
Mindfulmindset.life, and then you just click on the show notes per episode and you'll see everything there, including resources for what we talk about.
Yeah, it's good stuff over there. Another big issue that we see is liver disease. All the times that I've seen somebody have cirrhosis or liver failure or some kind of liver disease, I've always seen it being attributed to alcohol consumption.
Drinking. And it's so prevalent, it literally makes me sad. I almost want to give marijuana to people and take away the damn alcohol, because alcohol it's a drug. And it's awesome nowadays where, we're young, in our 20s, whatever age you might be, 30s. And it's fun where we have like a little binger, we wake up with a hangover, but we're not realizing this long-term effect of just dumping alcohol into our body. It's bad for you.
Yeah, someone jamming outside too.
I know, this Oakland area is freaking loud. The liver is this giant dumpster of the body. It's detoxifying, it's producing bile, it's storing, glycogen, it's doing all these things, and yet we're doing the thing that's causing so much harm to it. And liver disease is nasty in the hospital. The liver inhibits your clotting factors, and you have water in your belly. They got to get tapped once a week. Sometimes that shit drains.
You literally turn yellow.
Yeah, sometimes your skin is so itchy they can't stop itching. Another thing is the liver converts ammonia, so sometimes ammonia levels increase in the body. And for liver patients, we give something called lactulose. All the nurses probably just grinned a little bit, because lactulose binds into ammonia and gets excreted, but it comes out of the rectum. So basically you're pooping diarrhea to help you get rid of your ammonia, because your liver can't do it for you because you effed it up through all this freaking hardcore drinking.
Yeah, and the one is going to affect your brain, your nervous system, everything. It's literally your body going to build up of toxins, and the only way to get rid of it, the ammonia, is to give you a supplement to make you literally poop all of it out, because there's nowhere, it can't go anywhere. Your liver can't process it quick enough where it can't process it at all.
And sometimes patients don't take it and they come in for this and they get something called metabolic encephalopathy. Basically, it's a buildup of toxins in your body, and you basically go cuckoo. And these liver patients sometimes that we see are just bouncing off the walls, man, just saying some crazy stuff, being violent towards you, sometimes we have to restrain them because we can't control them until the ammonia level goes down.
Yeah, if you're using alcohol as a coping mechanism, or something that you something that you do daily just to relax, take the edge off, and that's not gonna do you much good in the long run. You're better off, going for a walk. I know it sounds easy to do, but once you start going for those walks, you're gonna be less dependent on drinking, because you're gonna be doing activity instead of drinking. Because drinking is technically an activity for you that you associate with, your day's done, you can relax. You're basically associating alcohol with a good time and something to do as a pastime to relax.
Yeah, it's like opioids, and you have a patient that doesn't want to take a narco for pain because they're scared that they're gonna get addicted because they hear about it. Well, I'm I have a question for you. Are you taking it to get high, or are you taking it because you have pain? When you take something for pain, you're not gonna get addicted to it. If you're taking something to get a high from, that's where the risk of addiction could happen. So, and back to what you were saying as well, when it comes to the coping stuff, people do not like to sit quiet with their thoughts and analyze what they're thinking. Instead, they go from stimuli to stimuli. They go from work, it was stressful, they come home and then, you know, their stimulant, which is a quick little alcohol. It gives you like a little high, whatever the case might be, and rinse, repeat. And you're coping externally, you're not learning how to cope within, which is internally. And that's where the whole battle is. And, you know, we talk about the mind so much.
Yeah, it makes you feel good, and it's addictive. So, you know, it's like sugar almost, but probably a little bit worse, you know. It's just something you get used to, and you just keep doing it over and over again, and, you know, you build a dependence, you build a tolerance, and you gotta need more and more and more, and then bang, you got liver disease and you die. Yeah, you die right away.
Stop drinking, guys. Simple. Do some other stuff. I don't know what it is. Don't do drugs, though.
Yeah, and drink, a lot of times, if you're an alcoholic, you're lonely, you're more predisposed to suicide. Suicide's been on the rise for both sexes, but majority of deaths with suicide occur in men. Suicide actually jumped from 19 to 22.4 per 100,000 individuals in men. So 22 point, it's almost 25%. Not 25%. 22. It's almost 25 out of 100,000 people who commit suicide.
Yeah.
That are men.
And on top of that, men are 3 times more likely than women. And probably because they don't like to open up, guys. So it's okay to share your damn feelings. You guys are all like, I feel like as a man, sometimes we're thinking like we have to be this rock. And we are, right? Where we have more strength and all that. I'm not gonna talk about equality, I know that, but like, you know, we kind of built so much and we feel like we have to like live up to that. And we're not opening up to people or telling how we feel, and then maybe somebody could give you a perspective that could completely change your life, but yet you want to hold that in.
Yeah, if something upsets you and you keep doing that thing over and over again and you don't tell anybody that it's upsetting you, you know, it like drains you down. Like you hate doing that thing. Let's say, for example, like you hate your job. I mean, it's kind of hard to change, but definitely change it. But if you hate your job and you come home and you drink and then you beat yourself down because you gotta wake up in the morning, that's not healthy at all. That's what you should be doing at all. You should, you know, settle for less income and get something that you'd be more pleasurable with.
Well, we're so stuck on this, like keep advancing, keep leveling up, keep grinding, and we never think about that maybe we should drop down a little bit, you know what I mean?
Yeah.